Let's briefly look at conditions that could make you want to treat an endocarditis caused by the Streptococcus viridans or Streptococcus bovis for about 2 weeks. Do you understand? Like conditions, okay? Conditions for 2 weeks treatment for Streptococcus viridans and Bovis endocarditis, okay? So that's what we're trying to look at. Just briefly, just to recap, endocarditis is what? An infection or a disease condition from as a result of what? Proliferation and colonization of what? Hard valves. It could be endothelium. It could be what? The blood vessels. It could be congenital anomalies, right? So looking at this now, condition for 2 weeks treatment for Streps viridans and Bovis endocarditis. If there's a native valve involvement, right? All those mitral valve, tricuspid valve, aortic valve, if they are involved, they have to what? Keep treating. Do you understand? Then if there's a minimum inhibitory concentration that is less than 0.1 milligrams per liter, keep treating. If there's no adverse what? Prognostic factors like heart failure, aortic regurgitation, or conduction defect, then you can just treat for 2 weeks and stop. Okay. If there's adverse prognostic factors, you have to keep treating. All right. If there's no evidence of what? Thromboembolic disease, there's no evidence of thromboembolic disease, you can just treat for 2 weeks and stop. Then if the vegetations are less than what? Okay, vegetations are more than 5 millimeters in diameter. So that means what? The infection is growing. Okay. Vegetations is like when you do, is it, well, vegetation is basically what? The organism, the microorganism, is to show how they are growing, how they are infecting different parts, right? So if you see the size is more than 5 millimeters, then you have to what? Treat for about 2 weeks, okay? Then clinical response within 7 days, okay? Clinical response within, okay, clinical response within 7 days. Okay, so that's it. So that's it for what? The conditions for treating this endocarditis for about 2 weeks.